Hello, my name is Carolyn Merriman. I'm a faculty in the College of Nursing at East Tennessee State University, and I would like to present today a deep dive for our Spring 2016 series. The title of this deep dive is The Mystery of the NCLEX-RN Unraveled, and this is just a basic explanation and looking at the NCLEX a little bit, and for those that are not as familiar with the way the test is run, what kind of system they use, and then some particulars about the test that will help us get our students ready and hopefully help us let them pass that NCLEX the first time so they can get on to practice. So the objectives today for this deep dive are that you will have an understanding of what computerized adaptive testing is, also known as CAT or CAT. The second objective is that we will identify the different components of the NCLEX-RN so that we can make sure, once again, that we're including them in our teaching and also in our testing. And then finally, it's just a reminder on how we can write NCLEX-RN style questions that are critical thinking, because if we can do that while we're in the College of Nursing with our nursing students, then they will be more prepared to handle the NCLEX-RN. So that's one of the things we'll do at the very end. So computerized adaptive testing, it's been in place for many, many years, as you all know, and many of you have taken the computerized NCLEX yourselves. I was one of those that took a written test over 3 days, paper and pencil. But they, many years ago, the National Council of State Board of Nursing decided that they wanted to try computerized adaptive testing. So they implemented nationwide this system. It is a test that is determining minimal level of competency for the students. So we need to let students know that you're going to be way more than competent, but what you have to demonstrate on this test is minimal level of competency. So I always emphasize with my students that it's about safety. How can you show that you would perform safely with your patients or clients, even on a testing situation? As most of you know, that the students can show this minimal level of competency. Most students will show it within 75, which are the minimum amount of questions that you will get. So a minimum of 75. For some students, they will go all the way to for the RN test to 265 questions. And that would be a student that is kind of on the borderline, that answers many questions right and many questions right at the line, and then some underneath the passing line. So they would continue getting questions until the test had clearly shown that they had achieved a passing level. As I said, most students achieve 75 questions, and it is clearly demonstrated that they are either minimally safe to practice nursing or that they have clearly failed the test. And so that can be determined in 75 questions if several things have been done at that point. One of those would be that the test plan or blueprint has been achieved, and we'll go over that. But level of passing has been reviewed every 3 years, and there's no exception. In 2016, there was a 3-year review. What they do is they interview all of the practicing nurses and determine what are the things that you do the most. And so every 3 years, the council makes a decision if the test should be changed. So the current standard for passing this test is the council decided to keep it at the same passing level as 2013, which I think is good news overall for us as educators and also good news for the students, but mostly for us as educators. What we found is that when the test was tweaked and made a little bit harder, then generally what we see are our NCLEX pass rates going down. So it's now at 0.00 logit. So if you want to consider the passing level on a timeline where there's 0 and positive 1, 2, 3, and then there's negative 1, 2, 3. What we've seen is that it's gone from like a negative number now to right at 0 as being the line of passing. So in your mind, think about that as a line of passing. So with computerized adaptive testing, one of the things that I would like us to do is to, the National Council of State Board of Nursing has put together a small tape recording or a little bit of like a YouTube video of how to understand computerized adaptive testing. And I want to show that to you. I think that you'll find that it could be useful to show to your students, whether they be beginning students or perhaps maybe seniors, just so they'll have an understanding of computerized adaptive testing. So let's go to that video now.
Compared to the dated pencil and paper test we all experienced in the past, Computerized Adaptive Testing, or CAT, uses today's technology to tailor test questions to your ability level and achieve faster, more accurate, and fairer test results. At the forefront of using CAT technology for high-stakes examinations, NCSBN has been using CAT for NCLEX since 1994. Let's take a brief look at how NCLEX using CAT works. The goal of CAT is to identify each candidate's competence by determining the difficulty level of questions a candidate can consistently answer correctly. We've invited these candidates to a fitness center because we think their workout can quickly help you understand the principles behind CAT. Let's say each free weight represents a question, and we want to determine how heavy a weight you can lift. In other words, how difficult a question you can answer correctly. In this example, the trainer has established that this size weight represents the passing standard, and this correlates to the minimum competence needed to practice entry-level nursing. The examination is designed to determine if you can consistently answer questions that are more difficult than the minimum competence standard, which in our example is this size weight. Lighter weights are easier to lift and represent questions that are less difficult than the passing standard. Heavier weights are more difficult to lift and represent questions that are more difficult than the passing standard. Each question, like each free weight, reveals more about the true competence level of the candidate. With each answer, CAT's calculation of your entry-level competence becomes more precise. When you answer a question correctly, you've provided evidence that you could probably answer easier questions correctly. For that reason, the next question selected will be slightly more difficult. Increasingly more difficult questions will be asked until you incorrectly answer a question. At that point, the next question asked will be slightly less difficult. If that question is answered correctly, then a slightly more difficult question will be asked next, and so on throughout the remainder of your NCLEX exam. Everyone will miss some questions because questions are programmed to be increasingly difficult until a question is answered incorrectly. How computerized adaptive testing works is illustrated by this map, which represents a candidate's progress through the NCLEX. The NCLEX passing standard is illustrated by the blue line. Questions below the line are questions that are less difficult than the passing standard. Questions above the line are more difficult than the passing standard. The map represents both the difficulty of questions asked and the competence estimate of the candidate's performance. In this example, the candidate successfully answers a series of increasingly difficult questions. Then the candidate begins to answer some questions incorrectly. After answering the minimum number of questions required, the candidate reached a competence level that is significantly above the passing standard. When competency is determined, the examination is completed and the candidate passes. Conversely, when it is determined that the candidate is not competent, the examination ends and the candidate does not pass. The number and difficulty of the questions will vary for each candidate. This is true for candidates above and below the passing standard. Some candidates will be asked fewer questions because a confident pass or fail determination was made quickly, for they consistently answered questions either significantly above or below the passing standard. Other candidates, however, who have competence levels near the passing standard, either a little above or below, will be asked more questions in order to determine their pass or fail results. To ensure complete content coverage, all RN candidates will answer a minimum of 75 and a maximum of 265 test questions. PN candidates will answer a minimum of 85 and a maximum of 205 questions. Though most candidates finish in about 2 hours, you'll be given up to 6 hours to complete the RN exam or 5 hours for the PN exam. This includes a tutorial and all break times. A candidate will pass the NCLEX if he or she answers at least the minimum number of questions and achieves a competence level significantly above the passing standard, answers the maximum number of questions and achieves a competence level above the passing standard even if not significantly above, or answers at least the minimum number of questions but runs out of time and has a competence level that has stayed above the passing standard consistently for all of the last 60 questions answered. A candidate will not pass the NCLEX if he or she achieves a competence level significantly below the passing standard, answers the maximum number of questions and has a competence level below the passing standard, runs out of time and has a competence level that falls below the passing standard at any point during the last 60 questions answered, or answers fewer than the minimum number of questions during the time allowed. Taking the NCLEX is the culmination of your studies, a thorough examination of your entry-level nursing knowledge, skills, and abilities. Passing the NCLEX demonstrates your competence and readiness to begin your career as a newly licensed entry-level nurse. Just like a well-designed fitness program can help prepare you for a healthy life, understanding how CAT works will better prepare you for the testing experience. At NCLEX.com, you can review other materials to learn more about the exam. Good luck.
So that video hopefully explained in simplistic terms, but explained what the process is as far as how test questions are given to students, and then from how they answer those test questions, whether they get a harder question or an easier question, until a firm decision has been made, computerized-wise, that they've either passed and or they've failed. Now, the one of the student myths is that they think that every 3 computers, they're automatically going to get 265 questions, but that is just not the case. And those are some of the myths that can be debunked. So, moving forward, one of the sites that I really recommend that all of us go to as educators is the National Council of State Board of Nursing site. And I have that site linked on the PowerPoint, but it's www.ncsbn.org. And so that will help us understand and also help students understand what the blueprint or the study guide, or that actually it's called a test plan, is all about. So when we go to that blueprint, what you're going to see on that is a definition of each of the areas that are represented that the students have to meet before they can, pass, or if they don't meet it, fail the NCLEX. So one of that, it would be the definition of each area. And the biggest areas on the exam are the client needs categories and then nursing process. So client needs and nursing process. And then we also have something we call integrated processes that are also on it. The other thing that's on this website would be a detailed content example. So under each one of those areas of the client needs, for instance, it tells you specific topics that we should be covering before the student graduates. They should have heard at least about one of those topics. So if you have any doubt about what we should be teaching in our curriculum and that the students should be hearing about, we need to go to that blueprint, that study plan, and we need to see what is it that the students need to understand or at least have some exposure to. So the other thing that's in this website, the National Council of State Board of Nursing website, are sample questions, NCLEX questions, and then they have a whole section on alternative format questions. There's some still, they're not really, I don't see on the site where they say exactly how many questions that are going to be alternative. The thinking right now is that the majority of the questions are still the question and the 4 answers, the regular multiple choice format. But I've heard some say that it's 10% of the test where you could have some of the alternative items. So looking at the National Council of State Board of Nursing website, you are going to see that the 4 client needs areas are safe, effective care, health promotion, psychological integrity, and physiological integrity. And what I've done on the PowerPoint is broken it down where you can see what the percentages are that are going to be covered on NCLEX. So the 2 that have subcategories are safe, effective care and physiological integrity. Now, safe, effective care you hear all the time, and this is what our charge is to make sure students are safe, minimally competent and safe care, but also that they know how to answer priority and delegation questions. Well, both management of care covers that delegation and prioritization. So as you can see from the slide, that percentage of questions could be between 17 and 23% of whatever the total questions are that the student gets. So those are important to go over with students. How to understand scope of practice, how to delegate, which client should you go see first. Those are the prioritization kinds of questions. The second part of that, under safe, effective care, is safety and infection control. And of course, that's what we value, that's what we emphasize all the time for students. So that percentage is between 9 and 15%. So that could be physical safety of our clients. It also could include psychological safety, but physical safety for sure. So aseptic technique and that type of thing. It's really interesting when you get down to the details and the nitty-gritty about what is under safe and effective care environment, what you'll find. So for instance, under management of care, of course, it's going to have leadership. It's going to have delegation. It even has some things like advanced directives and some of the legal issues. And then, as I said, under safety and infection control, it could have anything from how to put in a catheter or do a wound care or how to transport someone safely. Some of the fundamental principles about safety. Now, health promotion and maintenance does not have any subcategories, but it is about teaching and about stages of growth and development. So you're going to see health promotion and maintenance be about 6 to 12% of the total test. So I always think about things like the stages of growth and development from the child all the way up to the elder. I also see things like labor and delivery and the care of the infant, and any of the teaching principles. So one of the things that I emphasize to students to help them get ready for health promotion and maintenance questions is I always tell the students to a teaching principle is when they're looking at and thinking about what kind of option to choose with those kinds of questions, is that they should look at the option that allows the client to give feedback and have hands-on during the teaching. So when you're writing questions about teaching and learning, you might want to think about that. We also cover things like readiness for teaching, but always looking at that client being able to participate is really important. Psychosocial integrity is also 6 to 12%. So you can see that health promotion and maintenance is important and psychosocial integrity is important, but they're a little bit lower percentages-wise overall than the other 2 categories. When I think about psychosocial integrity, we know that communication questions, therapeutic communication questions, are woven into the NCLEX, and we should be weaving them in. No matter what we teach, we should also be weaving those into all of our lectures and our evaluation of students. So psychosocial can be therapeutic. I always tell my students when I'm getting them ready for NCLEX that when you're asking a question that's a therapeutic question, you're looking for, as far as what you're looking for as far as options, the strongest options are the ones that allow the patient or the client to reflect their feelings, so or to talk about their feelings, and so directed back towards the client, not back towards the nurse or anything else that's non-therapeutic. Besides therapeutic communication, another thing that's under psychosocial would be some psych principles as well. Some of the things about psych principles, the diseases, some of those other things could be in there too. Abuse, and some of the psychoses, some of the eating disorders, that type of thing. The largest representation on this blueprint or study plan or detailed plan is the area of physiological integrity. Physiological integrity, if you added up all those percentages, is pretty much over half of the test. But it has the 4 breakout sessions. So you do have foundation principles, which is the basic care and comfort. You do have pharmacological and parenteral therapies. And so basic care and comfort, and those are pretty self-explanatory. And then there's 2 categories. One is called reduction of risk potential. It's 9 to 15%. And when I think of reduction of risk potential, it's really interesting when you get into the detailed test plan. But what you're going to see under the detailed test plan for that is reducing risk potential. So that is where you see labs, helping patients, understanding and interpreting labs, getting patients ready for diagnostic procedures. Those are a couple of examples that I've seen under there. And then finally, under this big topic of physiological integrity, you have physiological adaptation. Students don't understand what that means, but what that means would be essentially complications of diseases and sometimes pathophysiology. And you can see that's 11 to 17%. So integrating pathophysiology and letting them bring that forward is really important. So you're going to see the nursing process also involved. So it could be that the students get questions about assessment, about planning care, implementing care, analyzing how they've done, and also evaluation. So we should be writing questions that are in all those different levels or have different stages of the nursing process involved to help students get ready for the nursing process. The integrated processes, besides the client needs and the nursing process, we have integrated processes, and we've always woven those into our curriculum. But the big one is caring, of course, and then also communication and documentation. We need to emphasize communication and documentation. Teaching and learning, and I already talked a little bit about those principles. I put in red the new one. The new one is culture and spirituality, and so it talks about interaction of the nurse and the client. It could be individual, family, or group. Recognizes and considers the client-reported, self-identified, unique and individual preferences. That's what comes from the National Council about what that means. So we've always put cultural and spiritual kinds of emphasis in our courses, but we need to make sure that that's even highlighted equally as much as these other integrated processes to help our students get ready for NCLEX. So my next slide just says, what are the changes? I've put that first, the integrated processes of culture and spirituality is being more emphasized. The other thing that has happened, even though they didn't change the testing level of difficulty, it's still the same as from 2013. What we have found is that they've eliminated intraoperative care. So now students will have questions about pre-op care and post-op care, but not intraoperative care. The other thing to remember, because pharmacology was under that big physiological integrity, is that we need to use generics for the medications. They will no longer be putting brand names on the NCLEX. So we need to help our students get ready and memorize the generics. And that might be a transformation for us because we're used to talking in terms of both of those. So with all this information, I really want to encourage all of you to go to pull up the document for the National Council State Board of Nursing website. They do have an educators tab, and then you can go to different areas, like they have a research tab, but they have a tab about NCLEX. It will tell you the ins and outs of what they recommend for students in getting ready for NCLEX. It also has the 2016 detailed test plan, and they have a regular one and a detailed one. Go to the detailed one and that will give you, like I say, topic by topic, what's underneath each of these categories. The other thing I like about this website is that it goes into what are the alternative format questions, and it has a frequently asked question tab. So for instance, one of the questions that I get from students a lot would be, for the select all that apply, how many are they expecting me to do? So there is a question about that. And so for instance, for frequently asked question on that one, it says under that the minimum option should be 2, but they don't want to give you what the maximum would be. So that's good for us to know as test writers for our students. We should never ask them to select all that apply and only have one option as plausible. So for us, we should have at least a minimum of 2, and then you can make a decision based on what you want to do. So if we're trying to look at all these other types of questions, multiple choice I talked about, the select all that apply, those are more like true or false. In helping students answer those are more true or false. They also have questions that are fill in the blank, and I know that you all are getting used to writing tests and stuff. Usually the fill in the blank are math problems. So one of the things to remember with students and tell students is that NCLEX will, on the question, tell them how to round. It'll let them know what the rounding rules are. Because I know every college around the country has different rounding rules, but it will tell the students round up to the whole number or round up to whatever the decimal points should be. We should also tell students that they only need to put the number in. They don't need to say something like 10 milliliters, they just need to put the number 10 in, and because the milliliters are already there. They also have audio is an alternative item, and audio is where the students will actually be listening to either breath sounds, heart sounds, or bowel sounds. And based on what they hear, they may have to answer a question, or maybe just identify what they're hearing. So those are the kinds of things that you'll hear for audio. There are also hotspots, and the hotspot ones are where the student, most of those are anatomy or physical assessment kinds of questions. It might say, for instance, where would you expect to hear bowel sounds the loudest? And so they would have to take their mouse and go to right lower quadrant, for instance, and make sure they're on the right lower quadrant, because of course we know that that's where the ileocecal valve is, and that's where they would hear it the loudest. Another question I've seen as an example is, where would a client that has mitral valve stenosis, where would you hear their sounds the best? And then the student would have to take their mouse and go to the 5th intercostal space, midclavicular line, with their mouse to show that's where it is. It's very sensitive, so we need to tell students to try to get as accurate as they can on the figure of it, whatever the chest wall is or the diagram is. I've seen another example of a question where it said, what part would you, on the ear, would you pull to before inserting an otoscope into a child's ear? And so that would be just on the pinna itself or on the auricle. But again, those are the kinds of questions you might see that are given. A lot of times anatomy, a lot of times just assessment kinds of questions. Another question that is an alternative item is where you actually have a chart, and the student has to review all the information in the chart, and then after they've done that, there's a standard question underneath it. So an example would be, maybe they would have some history of the present illness or diagnoses. They would have a list of the client's medications, and then they may have some vital signs. And then it would ask, based on reviewing of this chart, what would be your priority nursing action? So integrating some of those chart questions might be helpful to the students as well. The other thing that we're seeing is it's basically putting in the order of something like a skill or something, but I call it priority order, but it's something a little bit different. But they may have a list of 4 or 5 things that are tasks, and they have to put them in the order. So talking with students that have been on NCLEX journey, some of them have said it would be something like you're getting ready to do like a blood glucose monitoring or stick for your client. Put in the order of what you would do, and it even has things as detailed as checking the expiration date on the strips, washing your hands, gathering equipment, using alcohol, pludge it to clean the finger, and then that type of thing. So letting the students know things about, what would be the order depending on what their answers are. And I've seen priority order also used as an example for like a health assessment skill. So something like a student is getting ready to examine an abdomen, put in the order of operation how you would proceed. And then it would list the 4 operations of something like inspection and palpation and auscultation and percussion, and the students would have to put that in order, and they just drag and drop basically. They hang on to whatever it is and put it into first, second, third, fourth order. Of course, with abdominal, we're hoping that they will auscultate before they touch. So those are some of the questions that you may get. So with this knowledge about NCLEX, and again, I encourage you to go into that website and really just look around. What should we do with that, with information that we know about NCLEX and some of the changes? How can we prepare our students? So I would suggest that anytime we can, and I've been telling you, I've talked to students a lot, we need to talk about NCLEX with students from the very beginning course. And so the NCLEX success team, for instance, during orientation, greeted the new students and told them already that NCLEX success starts today. But so we want to talk about it early, give them the opportunity to look and start using resources. As faculty, we want to incorporate our critical thinking in the classroom and in clinicals, and of course that's what our goal is. But giving students opportunity to discuss, to analyze case studies, and not just for us to read from PowerPoint and expect that they're going to be learners, because adult learners need to have synthesis, opportunity for pulling things together and making sense and making it relevant to their lives. So critical thinking tests also, we need to be able to write critical thinking tests as faculty that actually are NCLEX style and that are at a level that are critical thinking, because that's what they're going to get when they go to NCLEX. And we need to, from the very beginning, start getting them thinking about Bloom's taxonomy and thinking about how we can go to that higher level of, which is application or higher, as soon as we can for nursing students. We also need to be very cautious about using questions from test banks that are out of textbooks, because they're generally not at a higher level. So we can use those as our starting point, but we want to be able to go on from there. So I also added in this presentation just a little bit about what makes a test item that we're writing for students critical thinking items. So using my reference of a book, Critical Thinking and Test Writing, from Morrison, Nybert, and Flick, there are 4 things that make a test more critical thinking. And this is, again, something that we can use to apply to help our students get ready. But tests should have rationale. There should be a rationale for the right answer and a rationale for why the other ones are wrong. They should be written at the application level or higher, and they should require, that's the second thing. So, early on we may have some definitions, which are the, very beginning knowledge or comprehension questions, but early on, even with Patient Care 1, we need to start using application questions. Questions that are critical thinking, they require more than one thought to be able to answer it. So multi-logical. The students have to think about several things in order for them to answer the question. That's what multi-logical means. And then they also ask for a high level of discrimination. So in the wording, we want to use things like most appropriate, effective teaching, best, what's the priority, what should the nurse do next. That helps really up the ante as far as critical thinking and what the students need to use. So I went on in here just to talk about rationales. Rationales are good for students because when they do a test review, they can learn from them. They're also legally defensible, so that if a student challenges what you are doing with a test question, you can say, here's the rationale, this is the reason for doing it. So I've got a few questions in here that show how a rationale could be done. Secondly, written at the application level or above, we know that it prepares students for the NCLEX. If we do that, it prepares them for NCLEX. It also, what is NCLEX about? We want our students to be ready for clinical practice, that they're going to be safe and competent practitioners. And that's what our tests that we write in class can do, and our experiences in clinical can also help. We also use more creative teaching methods when we write at the application level or higher, so we can take things from case studies or things that have happened in clinical. There's an example here about a knowledge question. It's about a child saying, what age should we expect the anterior fontanelle to close? Strictly a knowledge question. It says 18 months. Now, to make that into a comprehension question, we can say, when comparing the closing of the anterior and posterior fontanelles, what do you know about the anterior fontanelle? So again, that's comprehension, but it's not critical thinking. So if you want something to be critical thinking, here's the example. When performing a physical assessment on a 28-month-old boy, the clinician notes that he has an open anterior fontanelle. And here's the big like drum roll. What action is best for the clinician to implement? So what we've taken is they have to know when the anterior fontanelle is supposed to close by about 18 months, and that what's going to happen if they still have an open one past that time frame. And of course, at this point, the person needs referral, the little kid needs referral, and that's the right answer. And there's some rationale for that. Now, the third thing for test writing at critical level is multi-logical thinking. The definition, again, is that more than one fact is needed to logically and systematically apply these concepts. So thinking about when you're writing questions, ask yourself when you look at it and review it, does the student need more than one item to know to be able to answer that question? Another idea that I've heard people say is that if a student can find the answer to your question on one page, on one book, one page, then it's probably not an application question, because the concept should be higher level than that. So the example I've given is, which breakfast selection indicates that the client understands the dietitian's instructions about the dietary management of osteoporosis? Okay, so is that multi-logical? Well, how many concepts does the test taker need to know to answer that question? They would need to know what osteoporosis is. They would need to know what are some suggestions or what are some recommendations for someone that has osteoporosis. What kind of diet would they need? And then they would have to be able to figure out from the food choices which one would be the best as far as increasing calcium, and then again, which ones would decrease calcium absorption. So it kind of shows you how to use that. And then the last thing that what we can do to make our test questions more critical is that they're highly discriminating. And that means that all answers should be plausible. You don't want to have any ridiculous answers, any answers that the students can automatically say that it's not possible. I can get it down to 2 easily. And we want them to be able to rationalize, but not because and we all do, we get tired and we just choose a ridiculous answer. So if you've done that, forgive yourself, because I've done that too, but you try your best to make all the answers plausible that you can. So when you're thinking about plausibility and highly discriminating, here are a couple questions. Which intervention is most important? Or which intervention plan assessment data is or more critical? Which one should be done first, or which action should the nurse do first? Which one has the highest priority or response is the best? Those are hard for students to answer, but every time we write a test question with those kinds of highly discriminating key words, it will make our question more challenging and more thinking critically for the student, which is going to help them pass the NCLEX. So a young adult male is admitted to the ER following a motor vehicle crash in which he sustained a head injury. Which assessment finding provides the earliest indication that the client is experiencing increased intracranial pressure? Okay, so we're going to write rationale for that. We're going to determine to see if it's highly discriminating, which it is. It says earliest indication. You have to know several things to be able to answer that. So this question is considered a higher level or critical thinking question. So today's deep dive was just to kind of give you an overview about NCLEX and let you understand a little bit more about CAT and what the components are of the NCLEX exam, including, you know, the client needs, the nursing process, and integrated processes, what some of the changes are, and also just how you can apply that when you're helping students get ready. So from the very beginning, students, we need to be talking about NCLEX, we need to be preparing them with higher level test opportunities in the classroom and also test questions. I hope this deep dive session has been helpful to you. Thank you so much.